Hello and welcome to Aruchour in central Nepal. This is a village, or in a way more properly a collection of villages, arranged around a valley in a number of wards numbered from 1 through till 9. There's about 4,000 people here in about 750 houses, and Tillman Project has been operating here for the last 10 years. In 2012 we received a grant from the British Humane Association to invest in health projects, and this video is a report on what we and the residents of Aruchour were able to achieve. There were 3 main project areas.
र तपाईको पुरानो टोय कहाँ छ पुरानो
वहाँ छ
माथिमा र अर्को तल
अर्को यहाँ
जंगलमा हो र अहिले त्यो अघि तपाईले भन्नुभयो जस्तै समस्या थियो तलमा त्यो समस्या के हो
केही थिएन
त्यही बिरामी भयो है
हजुर बिरामी भयो यो हात चलेन खुट्टो चलेन
तर अब अलिअलि सजिलो के गाह्रो अहिले
अहिलेलाई अब ठिकै नि छ अब त्यही
ठिकै छ है
ठिकै छ.
So right now we're in Ward 9, one of the most densely populated areas of Aruchour. And what we found was that even though it's densely populated, there's a huge amount of lacking in terms of toilets and development. So what we did over the course of 4 months was discuss issues that were facing toilet building in the community with community members. And through their inputs, we were able to come up with a project scheme in which they contribute a certain amount of materials, labor, dig the pits, and then we on the other side contribute a small amount of material to help bring that project up.
This is the old one, and about a week ago they stopped using this because they finished the new one, the pit for the new one.
यो दिनुभयो अनि त्यो दिनुभयो अनि त्यो दिनुभयो हो यो दिनुभयो
र यो सिमेन्ट पिटोमा
यो सिमेन्ट त हामीले आफैले नि किन्नी
यो तपाई किन्ने हो ठीक
राम्रो बनायो हजुरले दिएपछि खुसी लाग्यो अनि मर्मत गरियो
धेरै खुसी लाग्यो धेरै राम्रो छ.
We found that there were maybe 50 or 60 houses in Ward 9 that didn't have any kind of toilet at all, which meant that you had a number of open defecation zones. This one behind us we were particularly concerned about because it's directly up the hill from quite a large school in the ward, and we're worried about the school's water supply becoming contaminated. So we've concentrated the toilet building on the houses just in this area, and behind me now has been declared an open defecation free zone. Because of this, we've now been able to provide a clean water project for the community living further down the hillside. In total, this toilet building project has provided 30 toilets to households which beforehand either had rudimentary toilets like this one or no toilet at all.
कति जना यो ट्याङ्कीसँग काम गर्ने जस्तै पानी लिने कति जना यो गाउँबाट
गाउँमा छन् धेरै कति घर छन् 50 60 कति घर छन्
50 घर
50 60 कति छन् यहाँ घर पानी नि जान्न के अर्को पाइप झारोमा अर्कोमा पानी जान्न के त्यो पाइप छ अर्को
यो तलमा
यसबाट आइराख्छ पानी जतिखेर सुके यहाँ आउँछ.
This is the junior school in Ward 1 of Aruchour. When we came here about a year ago we found a crumbling derelict tap stand with no water, and also the water that used to feed it is from a large existing tank which is polluted. We saw the water, it flows over open ground. So we met with the school to discuss their needs and to agree a budget for a new tank to be fed by clean spring water. We asked them, as we went on to ask all the other schools that we work with, to contribute towards the construction costs through materials, labour and also supplying food and refreshments to the builders. The new tank provides water for the school tap and toilets and also the local community. An idea for the future is to build an in-tank a little higher up the hill that will feed both the tanks, the old one and the new one, with clean filtered water. And that will mean that over 20 houses, 20 taps in the village, which are currently fed off the large old tank with the dirty water, will have clean water.
This is Kalika School. There was no water. Tillman Project funded to construct the water tank, tap and the pipeline to the toilet of this school. This is wherefore there was no tank from the spring for the community.
So we built this tank here to provide water for the community, and we also continued the line down to a nearby school, which also had problems with the lack of water. The school's toilets behind me were built a little while ago, but there was no water in the toilets, which meant that this area here was being used as an open defecation zone. Now that there's water both in the taps and in the toilets, this area is now clean.
कारकिनेटबाट घर बनाउन जाँदाखेरि काठ काट्दा खुट्टो काटो अनि त्यसमा उहाँको गाडीमा बयलेसम्म ल्याए यहाँ ल्याएर टोइलेट जान मलाई ठुलो गाह्रो भएर उहाँहरुसित भएर अनि त्यहाँ गएर यति टेक्न हुनेसम्म ल्याएर बुझाउँला भनेर लिएर आएर मलाई यसले केही टोइलेट बाथरुम जानलाई केही सहयोग भएको हुनाले अब यो लएर सन्तोषवासी बुझाउँला भन्ने.
The nearest major hospital is a 6-hour bus ride away, and there are only 3 buses each day, all of which leave in the morning. So for the people of Aruchour, this small 3-roomed health post represents their only real access to medical treatment, both for everyday problems and emergencies.
नमस्ते, मेरो नाम झलक नारायण खनाल हो. म यस आरुचौर स्वास्थ्य चौकी प्रमुख र विगत 5 वर्षदेखि म यहाँ कार्यरत छु र मैले देखेका विभिन्न स्वास्थ्य समस्याहरूमा यहाँ धेरै स्वास्थ्य समस्याहरू देखिएको छ, जसमा टिल्ड्रेन प्रोजेक्ट नेपालले विभिन्न महत्त्वपूर्ण सामग्रीहरू हामीलाई उपलब्ध गराएर ठूलो सहयोग गर्नुभएको छ, जसले गर्दा बिरामीको उपचार गर्नमा अत्यन्तै सहज भएको छ. अत्यन्तै कमजोर खाट थियो जुन हल्लिने खालको बिरामी सुत्दाखेरि नि भाँचिन्छ कि जस्तो र गुन्द्री ओछ्याइएको एउटा साधारण किसिमको खाट थियो, तर अहिले यहाँ एउटा राम्रो खालको बेड छ र त्यसैगरी हामीले सलाइन चढाउने बिरामीको लागि काँटीमा झुडाएर यो सलाइन चढाउने गरिन्थ्यो र सलाइन चढाउँदाखेरि निकै गाह्रो हुन्थ्यो. काँटी गाड्दाखेरि बिरामीको त्यो पोजिसन मिल्थेन, बिरामीसँग मिल्थेन र अहिले आएर यहाँ कुर्चीहरू छन् प्रशस्त जुन टिल्ड्रेन प्रोजेक्टले हामीलाई दिएको छ. यो कुर्चीले गर्दा बिरामीलाई बस्न र हाम्रो बैठकहरूमा समेत यसले अत्यन्तै सहज बनाएको छ. अहिले हामी आरुचौर स्वास्थ्य चौकीको ओपीडी रुममा छौं. हामीसँग एउटा फाइल क्याबिनेट छ, अनि अहिले राउन्ड चेयर छ, 2टा कम्फर्टेबल मेटल चेयर छ, एउटा टेबल छ र अक्सिजन सिलिन्डर छ जुन टिल्ड्रेन प्रोजेक्टले हामीलाई उपलब्ध गराएको छ, जसले गर्दा बिरामीको उपचारमा अत्यन्तै सहज भएको छ.
Officially, this used to be ranked as a sub-health post, but this investment has led to it being awarded full health post status. This has resulted in the provision of equipment from other organisations and the redecoration of the building. However, there is still much to be done before Aruchour has an adequate medical facility.
र हाम्रो सामान धेरै छ र ठाउँ चाहिँ हाम्रो साँगुरो छ. कोठा साँगुरो भएको कारणले काम गर्नलाई धेरै गाह्रो छ.
Regular meetings are now taking place working towards the construction of a birthing centre, a much needed facility which the community also believe will be a major stepping stone towards their ultimate goal of having a brand new health post built, large enough to properly cater for Aruchour and for the many health problems that its residents face.